All right, so this is Matt Boyd. Matt, do I have your permission to film you for my Kinesiology 6302 course?
You do.
And then do I have permission to show this video to my class of the 6302 course?
You do as well.
Awesome. So why don't you tell me a little bit about where you've been feeling pain?
Mainly feeling pain where whatever ligament connects to the bone here on the sort of the top side of my arm, around the corner from where you typically would get tennis elbow maybe. Right where it connects, but I really only have pain when it's under load, like doing a pull down or something.
Okay, so yeah, describe a little bit more about the movements where you feel pain there.
Yeah, I say just lifting weights, but actually even certain motions like shaking hands actually really hurts. So anytime when I'm putting it under stress, and it doesn't have to be a lot, it can be just a little bit of weight. I even grabbed kind of a wood cutting board last night and went to pick it up out of the sink, and that generated the pain as well.
So some gripping, shaking hands.
Mm-hmm.
What about opening doors?
No, that's okay.
Okay. And so pain 1 to 10, how bad would you say it hurts right now?
Doesn't hurt at all right now.
Great. And
just
then
a static state, it's fine.
great. And then while you're doing those things like lifting the cutting board up or
It can feel like an 8 or 9, but then it also has weakness associated with it too. So it's besides moving and wanting to move away from the pain, there's also just a lack of strength there.
are there any positions that make it feel better once that pain kind of comes up?
Just not stressing it. So just a normal stance is fine.
Perfect. Okay, so I'm gonna just take a look at an anatomical position. So face me with your palms facing forward. And I'm just gonna kind of compare your stance, so a little postural assessment, looking at left and right side. So it is the right side that he feels it. So I'm looking at all the bony landmarks, making sure there's no visible swelling. We'll look at the other side. And then go ahead and face around the other way so I can get a posterior view. And again, I'm looking at the cervical spine, the shoulders, thoracic spine, left and right, his carrying angle. He looks pretty good. Okay, go ahead and face me again. And I'm gonna watch you through some active range of motion on both sides. So facing me, I want you to flex both forearms and wrists like you're doing a curl. And then tell me, do you feel any pain anywhere while you do that?
No.
Good. And then hand out in front, both sides. I want you to twist your arm. It's called supination and pronation. Any pain while you do that?
Yeah. Right at the end, I can feel it.
Right there when you get to the last part of that's pronation. And then go ahead and show me where you feel that. Show me with the other hand.
And actually, not only do I feel it where it connects there, but I feel it kind of radiate down the arm a little too.
Okay. Any numbness or tingling?
No.
Okay. So now I'm going to palpate on the arm, and you tell me kind of where you feel that pain.
I think you're going to have to push, dig a little harder.
Okay.
Right there.
Okay. So 1 to 10 right there. How much pain?
3 or 4.
Okay. And then does that radiate down the arm like you said at all?
A little bit, but it lessens as it gets further
and then
away.
as I get closer to the elbow joint.
You're going to have to push harder.
Okay, that's good. And then nothing out here at
No.
the lateral epicondyle?
Mm-mm.
Okay, perfect. So I'm going to do a couple tests. They're resisted muscle tests. I'm going to do resisted wrist extension. So I'm going to take your wrist into flexion or extension, and I'm going to have you press against my hand. So go ahead and press up against my hand. Any pain there?
I can feel it, but it's not painful.
Can you show me, or are you feeling it in that same area?
Down the length of it. Yeah.
Okay, down the length of it. All right, here's another view of the resisted muscle testing. So I'm going to have Jules in a flex position, try to move into extension while I resist her. And I'll ask if she feels any pain there. And then, using this test, this is to just see if there's one of the extensor ligaments of the fingers, if that's involved too. So I want you to press up against that pressure. Any pain there?
No.
Let's do one more time so the class can see it right there. Go ahead and press. Good. Perfect.